Hi, class. This is Colleen. I'm here to talk to you guys about chemotherapy. This is one of the treatment modalities that you can use to help treat cancers. As we talked about, there are different types of cancers. We talked about how some cancers can be formed and how the cell's very fast dividing. So one of the treatment modalities is chemotherapy, so I'm going to start with that. The objectives are to state 3 reasons why chemotherapy should be administered, define chemotherapy terms such as adjuvant, neoadjuvant, induction, consolidation, maintenance, first-line chemotherapy, second-line chemotherapy, and palliative. And also to explain how chemotherapy works on cells and to list 3 types of chemotherapy types. So what is chemotherapy used for? To cure cancer, to control tumor growth, shrink tumors prior to surgery or radiation, relieve symptoms such as palliative care, and destroy microscopic cancer cells. So I found this great diagram and I thought this would be helpful for you guys. Here you can see the cancer cell and the different ways that chemotherapy can kill it, either through preventing blood vessel growth, stop cell division, cause spontaneous cell death, or create a non-dividing cell by altering cell structure. So some chemotherapy terms that you may be hearing, first one is adjuvant. This is used to destroy leftover cancer cells. For instance, a patient may have surgery done and the tumors removed, and the pathology shows that there still might be some leftover cancer cells floating around. So we want to nip that. So we'll administer adjuvant chemotherapy to destroy any cancer cells left over. Then we have neoadjuvant. This is administered prior to surgery. This helps shrink the tumor. For instance, if a patient had a large tumor size and we wanted to shrink that so there's less invasive surgery. There's induction. This is to induce a remission. Then there's consolidation. This is administered once the remission is achieved, but to continue remission. So basically, a patient will receive chemotherapy, the induction chemotherapy, but there's still risk that there's still some cancer cells floating around. Then they'll receive the consolidation. Then there's a maintenance chemotherapy. This is to help prolong remission. Some patients with ALL and APML use the maintenance therapy. I actually had a patient with ALL that continues to receive monthly Vidase injections that's maintaining his cancer. So it works great for him. First-line treatment is the standard therapy. This is the best evidence-based that there is for a certain type of cancer that will be administered first. And if that doesn't work and the patient relapses, they'll do second-line chemotherapy. Then there's palliative. This is administered for symptom management. So for instance, a patient has a tumor that's pressing against their lung and they're having difficulty with breathing. They'll administer chemotherapy just to shrink that tumor to help with their symptoms. How does chemotherapy work on the cell? It targets the cells in different phases of the cell cycle to allow for cell death and or damage. A combination of different chemotherapies are needed at times to fully kill the cancer cell. Unfortunately, with chemotherapy, all cells are compromised. So the red cells, which can cause shortness of breath or fatigue on patients. The platelets can drop, which can cause increased risk for bleeding. So we usually recommend using a soft toothbrush to prevent any gum bleeding. And then the white cells, that makes them immunocompromised, which means they're at high risk of getting infections. So we always tell them to avoid people that are sick and to make sure they're really washing their hands and to tell anyone that comes over to wash their hands. Some of the agents you'll hear are alkylating agents. This chemotherapy keeps the cell from reproducing by damaging the DNA. This is to treat lung, breast, ovarian, as well as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, and sarcoma. However, this type of chemotherapy can lead to leukemia due to the damage on the bone marrow. So as I was saying earlier, that chemotherapy can destroy all cells, but it can also destroy the bone marrow, which can potentially lead to leukemia. It's a very low chance, but it's still a risk that the patients take. We have the nitroserase. This type of chemotherapy is able to go to the brain. It passes the brain barrier. It's used for certain types of brain tumors. The anti-metabolites, this stops the DNA from copying itself. It acts as a substitute for the building of the cells by blocking the RNA and DNA. This prevents the cell from reproducing. These are used to treat leukemias, breast cancer, ovarian, intestinal tract, as well as other cancers. Anti-tumor antibiotics, the anthracyclines, they change the DNA inside the cancer cells to keep from growing. They bind with the DNA so it cannot copy itself and the cell cannot reproduce. These are used for several cancers. The one thing with this chemo, though, is can affect the heart. These patients receive an EKG prior to treatment to make sure their heart's okay to begin with, and then there's only a certain limit that they can get of the dose of the chemotherapy. So it's very important for the team to keep track of how many cycles the patients had and how much dose they've received. Then we have the topoisomerase inhibitors. I'm not going to pronounce them, I apologize. They're plant alkaloids. They interfere with the enzyme topoisomerase. They separate the strands of the DNA so they cannot be copied. And there's two different types, inhibitor 1 and inhibitor 2. The meiotic inhibitors, these are also plant alkaloids. They stop the cells from dividing into new cells. They can cause nerve damage. And there are two types, the taxanes and the vinca alkaloids. Now, with the nerve damage, what we call this is peripheral neuropathy. They can get numbness, tingling, or pain in their hands or feet. It's very important for teaching to these patients to make sure that they let us know if they're having any issues. Also, patients can have a reaction to the cold. For instance, if it's a little chilly out, for us, we're like, oh, okay, it's a little cold out, but for them, their hands will be burning. It can be very painful. So we recommend wearing gloves and socks. So as I said, the teaching is very important in the assessment. If a patient's having difficulty buttoning their shirt or dropping things, the dose might be reduced. They might have to totally discontinue the treatment, or they might delay it. Now we have the corticosteroids. These are natural hormone. Examples are prednisone, methylprednisolone, Decadron. They help treat cancer, and we use them to help prevent nausea. We use Decadron and Zofran a lot just to prevent the nausea during treatment. The reference I used was the American Cancer Society, and I really highly recommend that you guys take a look at this. This is a great site. There's a lot of information. We actually have patients utilize this site too if they have any questions. So I also have a video for you guys to watch and some extra reading, which I'm sure you guys love. So if you have any questions, please contact me and have a great day.